for this head to toe assessment, I'm going to be using my dog Kato as my patient. I know it's not the same as a human, but it's the best that I can do at this time. To get started with a head to toe assessment, or just in general, when you go into a patient's room, you'll knock and walk in, wash your hands, put on gloves, introduce yourself, and identify the patient, explain to the patient why you're there, kind of just give an overview of what you're gonna be doing in there. So, hi Mr. Kato, my name is Stephanie. I am going to be your nurse today. I am just here to do your head to toe assessment, just to observe your body and just kind of see if there's anything that I need to make note of. To begin with this, I can already get him set up with vitals. I can go through blood pressure, his pulse rate, heart rate, all that, and everything looks within normal limits. I can, if he would have spoke back with me, I could observe his orientation. If he's alert to person, place, time, and location, I would ask his name, date of birth, if where he's currently at, what day it is, potentially, the current president, what month, things like that. And then as I'm observing, I can observe his mucous membranes. Everything looks moist, pink. His pupils, they look equal, bilateral. They are reactive to the light. Listening to his ears, I can observe that his ears are dry, that they're pink. And when I'm listening or like observing the ear and looking into the ear, I would pull down and pull back just to observe the full inside of the ear. And then just moving down his neck, I would feel for any lumps, any large knots, potentially any swollen lymph nodes, things like that. At this time, he's fine. Everything's within normal limits. No lumps, no any abnormal knots or anything like that I'm feeling. And then as I'm moving my way down, I can observe his skin, which pink and dry and warm to the touch is what you want to feel. If he had an IV placement, I would look at his IV. I'm just going to take a look at your IV, Kato, and I would observe if it's clean, dry, and intact, if it's initial date, if it needs to be changed, anything like that. Just going to observe your capillary refill, squeeze the nail bed, and see a reaction of 2 seconds or less, which is good, blood flow. And then as I'm doing the head to toe assessment, I can just converse with my patient, ask them about their pain level. Kato, what is your pain level on a scale of 0 to 10? Depending on that will depend on medication. He seems pretty content, so I would say he's probably in the lower level of pain. He seems pretty good. From that, I would keep moving down. I would listen to the heart, and for him, if he will let me be able to do it, I will listen from the S1 and S2 spots and around for him. For his lungs, I would start listening underneath. I would place it and I would just have him take a deep breath for me. It's okay. Take a deep breath for me. And I would just be listening to see if I can hear any crackles, any wheezing, any fluid. I should hear just, clean sounds of the breaths coming in and out. And then you want to be listening to all the lobes, anterior and posterior. That way you can get a good listen for everything. And then as we move on down to his abdomen, you want to check all 4 quadrants, and you want to work your way from the lower right all the way around. And from there, you want to, as you're listening for the bowel sounds. If there's any active bowel sounds, you'll make note of which quadrants. If there are no bowel sounds, that's an indication that there might not be any bowel movements, something that you need to make note that could be an issue. And as you're listening as well, you're just making sure that you're not hearing any abnormal sounds or anything like that too. And then when you're palpating, you're just palpating the abdomen. Make sure that it's not hard, it's not distended, things like that. He seems pretty soft, pretty lean, and everything seems pretty intact. And you want to do that as all the way around for the patients, and you want to kind of go in like a zigzag manner. That way you can get the full range of the abdomen. And moving on down to the legs and the feet and the ankles. You'll check the pedal pulses. You'll just be checking all the pulses as you're moving down to make sure that there's proper blood flow. We can check his range of motion by just simply moving his leg back and forth. You can have patients move their arms, their legs, depending on their range of mobility. And then along with this, if he had thumbs and he was able to grab, I would have him test his grip strength. And he could grab my fingers and grip them, or if there's patients not able to do that, you can also do the test of where they can push down on your hands and push up on your hands, which will give kind of an idea of where they are on their strength. And then from there, you just want to kind of observe the patient's skin, see if there's any developed pressure ulcers, hopefully not, but you just want to observe if there's any new developed wounds. You just want to make sure the skin is pink, warm to the touch, and it looks clean, it looks dry. You don't want any moist areas because that can potentially end up with breaking down of skin. And if the patient had any tubes or drainage, Cato does not. He's all good, he's pretty healthy. But if a patient had tubes or drainage, you just want to observe that site, see for any redness, infection, anything like that, if they need to be drained, if they need to be cleaned, or anything like that. And then when you are done with your assessment, after you've observed your patient, taken down your notes, seeing how everything is, then you will just simply, before you leave, ask if the patient needs anything else. Tell them when you'll be back, usually within the hour, to check on them, and that would be the wrap up for that. And then you would document all of your findings from your head to toe assessment. And then when you're done, you'll also wash your hands, or remove your gloves and wash your hands.